Okay, so I'm really excited and hopeful about some changes that are coming through with the pharmaceutical strategy legislation. For many decades, Europe has lagged behind other markets like the US that have specific regulatory pathways to encourage companies like mine to expense the money in the trials to improve these well-known, well-tolerated older medicines. There's a pathway in the US called 505(b)(2). That's been existent for decades, and you see from data that that's allowed a lot of people to access incrementally innovated products. China, similarly, really has legislation that encourages the development of these products. But here's the setting in Europe right now. For a company like mine, we have to take the difficult decision to invest potentially millions of euros in clinical trials. And yet, if we are looking at a product, a chemical that's well known, it's quite likely we can potentially be treated as if that is a generic medicine with much lower costs to bring it to market. And that's not an incentive. That's quite honestly a disincentive. So what we're really asking with the pharmaceutical legislation is to recognise through Article 84 that there's an opportunity for Europe to provide better healthcare to the European countries, to save money as we do it. And all you've got to do is encourage this pathway to not just look at, for example, trialling a medicine in a new setting, but also looking at how we can create better, more tolerated formats that can take savings by reducing load in hospitals or general practitioners, or encourage better use of product. All of those reformulations add up. Now, we're not looking for a free pass. We fully understand anything we invest in has to create a health economic benefit. What we're asking is to make sure that we don't preclude and disincentivize developers like us from spending the money to bring better products to patients. So I think my ask with the legislation and my hope is that Article 84 goes through, but covers not just the repurposing of medicine, but also the reformulation of medicine, and that will incentivize the industry to invest.